Hello and welcome, everyone. Every conversation has the power to inspire, to challenge perspectives, and to spark new ideas. And that's exactly what we aim to do here at the Appna Alberta podcast. Today's episode is no exception. We are joined by a very special guest, Tammy Gamracy, someone whose journey and insights promise to make this a truly meaningful conversation. Before we dive in, let me introduce her and share a bit about her story. Tammy Gamracy is a registered nurse in Primary Care Alberta with over a decade of nursing experience. Prior to becoming a nurse, Tammy worked as a registered social worker, giving her a unique perspective on supporting individuals and families through their life transitions. Tammy currently serves as the pre and postnatal education team lead, Better Beginnings coordinator, and also works as sexual health nurse. Throughout her career, she has been dedicated to helping families access reliable information, build confidence, and connect with the supports they need. Tammy is especially passionate about teaching and supporting families during pregnancy, the postpartum period, and the early years of parenting. She believes that providing education, encouragement, and connection can make a meaningful difference in helping parents navigate both the challenges and joys of welcoming a new baby. So, we welcome you, Tammy, to our podcast. Thank you so much for joining us today. And we will be starting our first half. As we discussed, we have divided this podcast into different sections under different headings. So we will start our questions with the pre pregnancy era first. And my first question to you is, what are the important steps a woman can take before pregnancy to prepare her body?
Okay, well, thank you. And it is a pleasure to be here. By the way, I love talking about this. So what are some important steps that a woman can take? I think generally it's a really good idea to focus on your overall health before planning to get pregnant. So thinking about what you're eating, making sure you're eating well, you're staying active, you're getting enough rest, managing stress, that can all make a big difference. Having a conversation with your healthcare provider as well, to talk about things like starting prenatal vitamins, reviewing any medications that you're currently on, maybe getting support to reduce or quit caffeine, alcohol, tobacco, any other substances. Your physician can also get a really great medical history of you, of course, reviewing those medications and any individual risk factors that might determine whether you need any specific testing or screening or preconception recommendations.
Wonderful. Thank you so very much. My next question is, how can preconception care reduces common risks before a pregnancy even begins?
Mm. So, preconception care is about giving yourself the healthiest possible start before becoming pregnant. It allows you to identify and address any concerns early. So, taking those steps before you're pregnant can really reduce and support a healthier pregnancy for both parent and baby.
Okay, so part of education plays a very important role here, right?
Yeah.
Yeah,
hmm
thank you. Now we'll move to our next sector, which is managing pregnancy symptoms versus what will be the red flags that are often neglected or overlooked by the family and the person, pregnant female herself. So, my first question to you is, um, how do How do you advise patients to manage morning sickness, and when does it cross the line into an emergency?
Mm. So uh, it's quite common that women will feel um, morning sickness, especially in that first trimester. Eating small, frequent meals, avoiding an empty stomach, staying really hydrated, getting plenty of rest, really trying to avoid any smells or foods that might trigger nausea, those can all make a big difference. Some people also find ginger products to be helpful, such as ginger tea or ginger ale. When morning sickness starts to become a concern is when you can't keep those fluids down, when someone's showing signs of dehydration. So things like dry mouth, feeling unusually thirsty, dizzy, maybe only passing a small amount of urine. Those are all signs that medical attention is needed. And if your symptoms are severe enough that you can't even drink fluids without vomiting or feeling very nauseous, then that's absolutely when you should seek some emergent care for that. I think the most important message is that while nausea and vomiting can be a normal part of pregnancy, you don't have to suffer through it alone. If it's affecting your ability to eat or to drink or just function day to day, then definitely reach out to your healthcare provider for support because there are treatment options that are safe.
Great. And this is such a useful information because, yeah, this is very common in our pregnant
Mhm,
females.
mhm.
What are the normal energy changes during pregnancy versus fatigue that points to a medical concern?
So, feeling more tired than normal is a normal part of pregnancy, especially in the first and third trimester. I mean, when you think about the fact that you're growing somebody else's eyeballs and brain tissue, and of course, there's going to be some fatigue with that. That's an amazing, incredible thing to be building a human. So your body's working very hard. When fatigue becomes concerning is when it suddenly comes on suddenly or becomes very severe or continually gets worse, and again inhibits your ability to function day to day. Also important, if your fatigue is accompanied by other symptoms. So, for example, if you're really, really tired and you're also sort of dizzy or short of breath, or you feel like fainting and your heart is beating really fast, that's concerning, and we really want you to talk to your healthcare provider. So, I feel like I say this a lot, but my advice over and over again is to listen to your body and to just not hesitate to reach out if something feels off um, and or it just doesn't feel right.
Great. Thank you so very much. My next question is, how can families tell the difference between normal pregnancy swelling and signs of preeclampsia?
Mm. So some swelling is during pregnancy can be completely normal, especially in the feet and the ankles. And we notice that later in pregnancy. Uh, it tends to gradually develop and often get worse during the end of the day. This can be resolved, often women will put their feet up, drink some extra fluids, and sometimes that resolves. When we're concerned about swelling is when, again, it comes on suddenly, particularly in the face or the hands. If that swelling is accompanied by severe headaches, any vision changes, any pain in your upper abdomen, nausea, vomiting, elevated blood pressure, those can be pretty big warning signs of preeclampsia, and we want that to be assessed right away. So again, if that swelling seems sudden or significant, or accompanied by any of those symptoms, I don't want you to wait. Sometimes um, we have a tendency sort of to gaslight, especially as women, we gaslight ourselves, say, oh, we'll just wait till the next prenatal appointment, or it's probably nothing. But in that case, I don't want you to wait. That's something that needs to be assessed right away.
Thank you so much, Tammy. The last question in this section is, what type of abdominal crampings are normal, and when should a patient head straight to the hospital? And we know that this is very common, especially in
Mhm.
primary gravidas.
Yes, yes. So mild cramping can be normal in pregnancy. As your uterus sort of grows and grows, there's some stretching on those ligaments. So most people will experience some occasional pulling or aching, or even like very mild menstrual-like cramps. You also have your digestive system is very compressed during pregnancy too. So it's normal to have things like gas, bloating, and constipation, and that can cause some abdominal pain that maybe you might not have experienced before. When what we worry about is when pain is severe or constant or getting worse or accompanied by other symptoms. So if you're feeling that cramping and you're having, for example, vaginal leaking or any bit of vaginal bleeding, fever, again, severe pain, abdominal pain, regular contractions, decreased fetal movement, those are all sort of additional signs that we would want you to seek emergency or medical attention right away. Now, again, I always say when you're in doubt, just just go. If it feels significant and different from what something you've experienced before, and if you're concerned enough to have it to be worrying about it, it's always appropriate to call and to call or to go in to your healthcare provider.
So that's amazing advice. So the thing is that all our pregnant females or those who are planning pregnancy, they need to understand the whole course of pregnancy, and we'll come to that in my next question. Uh,
Okay.
our next session or part is of postpartum awareness and mental health. So, my
Mm.
first question to you will be, what do most families completely underestimate about the fourth trimester and postpartum recovery?
I really like this question. There's sort of a lot to unpack with that, um, because I think it's a huge transition. And we often hear a lot about the joy of bringing a new baby home. And yeah, it's joyful, it's wonderful. But we don't always talk about the reality of recovering from pregnancy and childbirth while also caring for a newborn around the clock. So, a lot of parents are often surprised by the physical recovery, the sleep deprivation, and the emotional ups and downs. And that all of those things impact mental health and overall well-being. So that's a big thing that's overlooked. I also think there's a lot of pressure to bounce back um, once you've had that baby to return to your pre-pregnancy self. But the reality is that postpartum period is a period of healing and adjustment. And so it's really, really important to give yourself grace and to lower those expectations where you can. And remember that recovery takes time. The other piece that I would add to that is to accept help when it's offered. I have a lot of conversations with new parents, and one of the biggest struggles is difficulty accepting help or feeling guilty about accepting help. And the reality is, parents aren't meant to do this alone. And so, if you have a support network who is ready and willing and wanting to support you, then I would absolutely welcome that support as much as you can.
That's so true. That is so true. Very well said. Uh, how can partners and support networks best protect a new mother's mental health after birth?
Mhm. I have lots to say about this as well. I, I, so number one, it's really important to regularly check on mom, not just baby, but mom, and not just are you doing okay, but including are you eating? Are you hydrated? Have you rested? Are you feeling well supported? Really checking in on her, taking on those practical household tasks, and even the mental load of things. So whether you're helping with other children or grabbing groceries or just cutting up fruit or cleaning or having just being there for her, that all goes a long way. And on that, sort of on that note, I also encourage partners to ask what type of support would be most helpful. Because, so for example, do you want me to hold the baby while you have a shower? Or do you want to take the baby and I clean the house for you? Or do you want to just have a conversation? Do you want to go for a walk? Just this weekend, I was running a class and I had a mom talk about how she has great family support and she's just starting to feel very isolated. She'd been living in the basement with extended family. And a family member said, I'm just going to come and help you. I'm going to take the baby, and took the baby upstairs. And this mom said, well, it was really nice, but I actually was lonely and I actually just wanted someone to talk to me for a little bit. So important to ask how can I help? What can I do? The other part of supporting mom's mental health is really to be able to make space for that wide range of emotions. Because again, I said there's lots of joyful moments, but there's also tears and frustration and feeling overwhelmed and self doubt. And I think rather than sort of rushing to fix those feelings, just allowing space for that and knowing that that's normal. Reminding her that she's doing an amazing job and that she's not alone in this. Um, Lastly, and this is a tricky one, I think it's really important to resist the urge to give unsolicited advice. This comes up a lot in our postnatal classes as something that new parents really struggle with. Instead of telling her what she should do, maybe ask her if she would like a suggestion. Uh, because if you're feeling supported and respected in your own choices as a new parent, that makes a huge difference in your confidence and your mental well-being. So that would be my final thing, is just to sort of be gentle with the advice and really help empower those new parents with the decisions that they have decided to make.
Exactly, because being a parent, one thinks that our experience, they just try to tell others that do like this, but
Yeah.
everybody has a different
Yeah.
personality, different circumstances. So very beautifully said. Thank you for saying that. Um, the question is that. And this is a very important question actually, that what will be the crucial red flags for
Mhm.
postpartum depression or complications that require urgent medical care?
Okay, yeah, this is a really important topic. Uh, it's normal. It's normal to have some ups and downs after a birth. We often refer to it as the baby blues. So it's normal. We see this in the first couple weeks, sort of tearfulness, some mood swings, maybe feeling overwhelmed. However, if those symptoms persist past a couple weeks, or become more intense, or start to interfere with that person's ability to care for their baby or care for themselves, then I think it's important to seek some help. Red flags that we see around that perinatal mental health is, we kind of break that up into two sort of different categories: hyperarousal and hypoarousal. And so those are sort of emotions. So if I talk about hyperarousal, those are emotions such as irritability, anger, rage, frustration, anxiety. Um, those are sort of what we see as red flags in on that end. And something that sometimes we overlook is the hypoarousal, which is equally needs attention, and that is those emotions such as sort of just a loss of interest in things, an inability or sort of a loss of interest in taking care of yourself, um, lack of motivation, yeah, to get dressed or to shower, to the baby, not feeling connected to other people. Disassociation, we might see behaviors like endless scrolling, or sort of maybe hear parents say, I just kind of feel like outside of my body a little bit. And those are all red flags that would warrant absolutely talking to a healthcare provider and getting some more help. Now, some of the most urgent warning signs that would require immediate medical attention would be thoughts of self-harm or thoughts of harming the baby. Postpartum psychosis, where we would see symptoms such as hallucinations, delusions, confusions, a bit of a loss of touch with reality. So again, those symptoms specifically are medical emergencies. And I often tell parents to trust your instincts. If something doesn't feel right, then to reach out. And as a partnership, as a whether you're husband, wife, mom, sister, family member, friend, it's important to keep those mental health conversations open. So I often talk about in prenatal classes, I talk about having that conversation before the baby's born, because often when you're in those sort of states, it's hard to recognize it. And it's usually the people who love you the most who will recognize that. So having that conversation with people who love you, saying, hey, if you notice that I'm not myself and you're concerned, I just want to give you permission to please bring that up and please help me to get help.
Beautiful, wonderful. I mean, that's such a gentle but the most needed advice. And people usually tend to overlook this
Yeah.
in their excitement and in all those things. This is the baby blues is usually overlooked, and they just
Yeah.
lead it to label it as fatigue and stuff like that. Yeah.
Yeah.
So, yeah, now we are moving to the last part of our podcast, connecting families to resources, which is, I think, again, is an extremely important thing our audience should know about. So my first question will be, when should a patient call HealthLink 811 versus scheduling an appointment with their primary care team?
Hmm. Well, the great news is you kind of don't really have to figure that out on your own. The nice thing about Alberta is that we actually have we have 811, HealthLink 811, but we also have a new parent newborn line, parents who have newborns up to the age of 2. And both of those services are available 24 hours a day. So if you call that, you're kind of not sure what to do. A registered nurse will listen to your concerns and ask you questions and help you determine whether or not what you're seeing is normal, or if maybe you need to follow up with your family doctor, or if it's more of an urgent situation. So that's kind of the great thing, is that you don't really have to know what to do if you're unsure. You're welcome to call one of those lines and talk to a registered nurse. Now, if it's something that's, I would say, ongoing, if it's non-urgent and it's ongoing and it might require someone to assess a little bit further, then I would definitely follow up and schedule an appointment with your physician.
Okay, great. Thank you. What free local programs or home visit services does Primary Care Alberta offer to new parents?
So aside from the new parent newborn line, I always love to recommend Healthy Parents, Healthy Children to new parents. It's a free online resource that has reliable, evidence-based information from everything from pregnancy to feeding to infant development and parenting. So that's a really, really great resource. In prenatal classes, I often encourage parents to actually pull it up on their phone and add it to their home screen. So it's right beside Google. So that website you're able to open up and search, um, and then you find evidence-based information that's relevant to living in Alberta and living in Canada. Another program we have is called Better Beginnings, and that's I'm actually the coordinator for that program. Now, that program is an amazing program. It's a free supportive health service for anyone who's pregnant but has some additional challenges. So, if you're pregnant, again, we already know how difficult it is just to grow a human, period. But when we add any additional challenges, such as maybe new to Canada and there's language barriers or psychosocial barriers, mental health, addictions, low income, any of those extra factors can make having a healthy pregnancy a little bit more difficult. So, Better Beginnings is a great program that helps clients navigate the healthcare system while they're pregnant and have a newborn. We have a lot of, we create or we refer a lot of clients to outside resources and just sort of connect them depending on where they're at. So that's another great one. We also have, and it's not necessarily in primary care. I mean, there are some primary care agencies associated, but we also have something called Alberta Family Resource Networks. So even if you just Googled Alberta Family Resource Network, that brings you to a page where there's lots of programs that are available for families, parenting education, support groups, connection to resources, and other opportunities to meet other parents. Now, following the birth of your baby, you actually will have a public health nurse who immediately, within 24 to 48 hours, will contact you. And that nurse will come, she'll either come to your home or have you come to the office, or it will be a phone assessment. And she'll help assess mom and baby, but also, so assess mom and baby, provide some feeding support, but also connect with relevant resources right at that time. So that's also a critical um, service that is, you just get that. And you don't have to call that. Nurses are just notified when you're discharged from the hospital. So those are some, I would say, some of the most important resources that we have. I know there's lots, and sometimes they're continually changing, but those are some great ones. We also have prenatal and postnatal classes within primary care that are really, really important for parents as well.
Thank you so much, Tammy. I mean, especially sharing the different resources that are available in the Primary Care Alberta services. It is, I'm sure our audience will definitely take a note of it, and they will be utilizing these resources and helping in community people and females and families who require them. So I think this was an amazing information. Thank you for sharing it.
Yeah.
Another question that comes up very often is, where can families find culturally sensitive mental health support if they are struggling postpartum?
So there's actually a lot of support out there. E- Even if at the very least you called HealthLink or the newborn parent line, you would be connected to local mental health and parenting support. If you needed language line, they would absolutely include that as well. So that would be in, specific languages. Recovery Alberta also provides 24/7, there's a 24/7 mental health helpline. And with that, families can receive support, information, and again, referrals to their community. Um, the other thing we have is postnatal classes. Now, those are actually a very significant protective factor to mental health. One of the biggest things new parents have in common is that they've just welcomed a new baby into their lives. So regardless of sort of that cultural background, they're navigating a lot of those same challenges. We have families who participate from many different backgrounds and cultures, and so it often leads to a lot of meaningful conversations about mental health, parenting, family support, and all sort of how that's viewed and experienced through different cultural lenses. And so those are some of the most powerful discussions that we have because we're having them in a safe space where people are able to be vulnerable and talk about, how they're balancing maybe some of their traditions with current healthcare recommendations here in Alberta. So that can also be protective as well. So there's lots of mental health support for people that's covered by Alberta Health.
That's so encouraging, and so, it helps us to feel comfortable that yes, this special group, females who are getting pregnant, have so much resources, so many resources to tap on and to get the help from. I know that I'm asking some questions which feel like kind of a repetition, but this is very important because we are breaking down the resources and trying to come up with all the resources and let our audience know about it. So, how can community health centers help families to face language barrier or lack a support network?
Mhm. Yeah, I think that is a really good question too, because often for people who have language barriers, um, we're often maybe the first connection to the healthcare system is when they're having a baby, and navigating appointments and resources and services all in a different language or a different language can be really, really overwhelming for people. So one of the most important things, and is vital, obviously, is having language translation services. A hard stop right there is so important to be able to for clients to be able to um, ask questions and feel understood in their own language. I can tell you how, I've had a conversation with a woman who's sort of trying it in English, and the moment I say, can we get a translator, and then you can ask this in your language, and the relief on you can just kind of feel the relief and the feel that tension dissipate as she's able to just really talk about what's concerning her, and knowing that she can be really understood. So that's really important. Just making them feel safe and allowing them to, yeah, communicate in their own language. Um, the other part of it too, I think when we're working with, when there's a language barrier, is allowing that time capacity and really acknowledging that it's going to take more time. And so allowing, we can't have the same timed appointments for someone who's speaking fluent English. If there's a language barrier, we just need to have a lot more patience, and we need to allow a lot more time and space to be able to make those clients feel comfortable. And ideally, too, a big part of that is to help them connect with other parents, because um, feeling connected and supported, that's a huge part to just feeling like you're um, making it as you're, raising this new baby and trying to navigate all those things. So that's also a really important factor to that.
Right. Thank you so much. And now we are coming to the end of our podcast. I have one more question left for you, and that is, why are prenatal classes so beneficial for first time parents?
Um, no, this I'm very passionate about. I think prenatal classes should be mandatory for new parents. The reality is you don't know what you don't know, and prenatal classes are so powerful in just reducing anxiety, reducing fear for people. It gives you an idea of sort of what to expect, and gives people a lot of tools on how they're going to cope, and understand that they do have a lot of options. It's also really important for that support person. We sometimes overlook that support person, but prenatal classes are really important because as the support person, you really learn about how important you are to that role. We know that when mom and baby are supported through that perinatal period by someone loving and safe, they both do better. And so in our prenatal classes, we really, really also focus on that support person so that they come away feeling like they're really important. And the other part about those prenatal classes is sometimes we sort of just think about um, the pregnancy and the labor and delivery, which is very important. But something that we also focus on in prenatal classes are the postpartum aspect of it. So what to expect, what happens after the baby comes out? How do I feed, diaper, change a baby? And also we really discuss what is the reality when we come home with the baby? What is that actually going to look like? And what are some things we can do to prepare ourselves for that? So prenatal classes are very, very important, just to give you a sense of confidence and encouragement about that whole process.
Amazing, amazing. Thank you so much, Tammy. It has been wonderful discussion, and I mean, for myself also, I have learned so much new things about the resources, about the passionate attachment of the treating team with the community, and especially this vulnerable group, which is the pregnant females and their partners and family members, because we have so many cultures who have come in, and we are now one Canadian network. So, yeah, understanding each one of them and then bringing them to the best for their betterment. You guys are doing an amazing job.
Thank you. We're trying.
Yeah, yeah. And thank you again. And thank you, everyone, for joining us for the Appna Alberta podcast. Stay tuned till we meet again. And if you have any questions, please feel free to send us the questions on apnaalberta@gmail.com, and we will pass it on to Tammy. And if Tammy, is there any other way they can ask you questions, please let us know so that we can bridge this gap.
Okay, perfect. Yes, you can reach out at, I can leave my contact information with you, but you can also reach out and also contact us at pre-postnatal at Alberta or at primarycarealberta.ca. You can reach out via email um, or contact any public health office in the zone, and we'll be happy to answer any questions.
Thank you so much, Tammy. That was
Thank
amazing.
you.
Thank you for your time. And thank you, everyone, for watching our podcast. Till we meet again, goodbye.